Although there is no prevention available for dementia, there is a lot of neuroscientific research that is indicating there are certain things that you can do to reduce your risk of developing the disease. There are a lot of studies at the moment looking at the benefits of physical exercise. And by that I mean exercising, say, 3 times a week, maybe for 20 minutes of light exercise. Also, research is indicating that if you maintain mental activity, that your brain still maintains the capacity for neuroplasticity. What that means essentially is your brain's ability to make new cells and make new brain connections. And by building up this cognitive reserve, or brain reserve is another term, people appear to be more resilient to developing dementias. A lot of people ask, if I do crosswords and Sudoku, will it help prevent Alzheimer's disease? Although those are good cognitive tasks, they in themselves are not sufficient. One of the reasons is we tend to do what we're good at, and what the brain really needs is challenge. So trying something that you don't know or not good at is actually the best thing to stimulate new brain growth. So learning a language, taking up an interest, something new is far more beneficial than doing things that you're already familiar with. Generally, everyone can look after their brain health. So there are a number of things we can do that fundamentally impact upon our brain to function across the lifespan. Stress is not good for the brain. Stress causes cortisol, build-up of cortisol within the brain, and that undermines brain function over the longer term. Obviously, smoking is a risk factor for cancer, but it's also a fundamental risk factor for vascular dementia. In addition, diet is really, really important. Not only is a poor diet bad for your brain, but if you have certain healthy diets, they are very advantageous and improve brain function. There are risky behaviours that predispose you to perhaps having a head injury, a traumatic brain injury, and obviously that's bad for your brain and also is a risk factor for dementia.